Central sleep apnea. This less common from a sleep apnea occurs when your brain fails to transmit signals to your breathing muscles. This means that you make no effort to breathe for a short period. You might awaken with shortness of breath or have a difficulty time getting to sleep or staying asleep. So kung yung kanina ay obstructive means meron parang bumara sa iyong airflows, this time walang bumabara pero hindi gumagana yung breathing muscles mo dahil sa failure ng pag-transmit ng signals ng brain mo sa breathing muscles mo. So risk factors for central sleep apnea include being older, being male. Because older people are most likely to get central sleep apnea because their brain might not work that efficiently as a young. So they might be failure in transmitting signals to the breath muscles, and males are more prone to sleep apnea than females. Next is heart disorder, using narcotic pain medication, and stroke. Having congestive heart failure increases the risk of having central sleep apnea. Also, for narcotics, pain medication, opioid medication, or for those long-lasting ones such as methadones, increase the risk of central sleep apnea. Also, having stroke also increase your central sleep apnea. Now let us compare obstructive sleep apnea, hypopnea, and central sleep apnea. In obstructive, the airflow is being blocked, but in central sleep apnea, there is no airflow. The cause of the problem in obstructive sleep apnea, the muscle relaxes in the throat and it blocks the airway. But in central sleep apnea, the brain did not transmit any signals to the breathing mechanism or breathing muscles, so there is no airflow going inside our body. It's also stated obstructive sleep apnea, most common sleep apnea caused by blockage of airways, often causes loud snoring. As for the central sleep apnea, it is not caused by airway blockage. The brain does not signals the muscles to breathe and does not typically causing snoring. So let us proceed to diagnostic criteria. A. Evidence by polysomnography of 5 or more central apneas per hour of sleep. B. The disorder is not better explained by another current sleep disorder. Specify whether idiopathic central sleep apnea characterized by repeated episodes of apneas and hypopneas during sleep caused by variability in respiratory effort but without evidence of airway obstruction. Cheney-Stokes breathing, a pattern of periodic crescendo-decrescendo variation in tidal volume that result in central apneas and hypopneas at a frequency of at least 5 events per hour accompanied by frequent arousal. Central sleep apnea comorbid with opioid use. The pathogenesis of this subtype is attributed to the effect of opioids on the respiratory rhythm generator in the medulla, as well as the different effect on hyposic versus hypercapnic respiratory drive. Specify current severity. Severity of central sleep apnea is graded according to the frequency of breathing disturbances as well as the extent of associated oxygen desaturation and sleep fragmentation that occur as a consequence of repetitive respiratory disturbances.